She went to her gynecologist for help with a medical concern. She left feeling confused, uncomfortable, and deeply unsettled. And when she turned to the internet to ask a simple question, "Is this normal?" the response she got was overwhelming. Thousands of people had the same reaction she did. Something was very, very wrong. What happened in that exam room is something every person with a female body needs to hear about. Because the line between medical care and misconduct can sometimes be blurred, and knowing the difference could protect you or someone you love. Let's talk about it. So here's the background. A 28-year-old woman was experiencing a common but frustrating issue: difficulty getting or staying lubricated during sexual activity. This is a real medical concern that affects people of all ages, and there are legitimate, well-established ways to evaluate and treat it. Hormonal imbalances, stress, certain medications, nerve issues, and psychological factors can all play a role. It's absolutely something worth discussing with a healthcare provider. So she did the right thing. She made an appointment with a gynecologist. She showed up, she was honest about her symptoms, and she put her trust in a medical professional to help her figure out what was going on. That's exactly what patients are supposed to do. Now, before we get into what happened, let's talk about what a standard gynecological exam actually looks like for this type of complaint. Typically, a doctor would take a thorough medical history, ask about medications, stress levels, relationship factors, and hormonal history. They might order blood work to check hormone levels, estrogen, testosterone, thyroid function. They might do a basic pelvic exam to check for physical abnormalities or signs of atrophy. They might refer the patient to a specialist, a pelvic floor physical therapist, or even a sex therapist. What they would not do, what is not a recognized evidence-based clinical protocol, is manually stimulate a patient's genitals in the office. Full stop. Now let's walk through exactly what this young woman described because the details matter. She arrived at the appointment and initially had what she described as a basic exam. So far, so normal. But then things took a turn. The doctor asked her to fully undress, not just remove her lower clothing as is standard for a pelvic exam, but completely undress. He then had her get into the stirrups, which is the position used for a pelvic examination. Here is where it gets deeply disturbing. The doctor told her that as part of the pelvic exam, he would be touching her clitoris. He framed it as a way to assess the response of her genitals and nipples. He explained this beforehand. He wore gloves. He was, by her description, professional in his demeanor. And then he proceeded to manually stimulate her clitoris for approximately 1 minute. After that minute, he noted that she had become slightly lubricated. And then, and this is perhaps the most alarming part, he told her he would step out of the room so that she could stimulate herself further to see how long she could maintain that lubrication on her own. She described the doctor as professional throughout. He wasn't aggressive. He didn't lunge at her. He explained what he was doing. He used gloves. He stepped out to give her privacy. And yet, something felt profoundly wrong to her. She couldn't shake it, and she was right to feel that way. When she posted her story online asking whether this was a typical exam for an arousal complaint, the response was immediate and unanimous. Medical professionals, survivors of assault, legal experts, and everyday people all said the same thing. No, absolutely not. This is not a standard exam. This is not an accepted medical protocol. This does not appear anywhere in gynecological guidelines. What she described sounds like sexual misconduct under the guise of medical care. Here's something important to understand about predatory behavior in medical settings. It often doesn't look the way we expect it to look. We imagine something violent or overtly threatening. But research on medical sexual misconduct shows that it frequently happens in a calm, clinical environment. The abuser relies on the authority of their position, the patient's trust in medicine, and the performance of professionalism. Gloves, explanations, stepping out of the room to make what they're doing seem legitimate. This is sometimes called procedural grooming. By explaining the procedure beforehand, acting calm and clinical, and framing the assault as a medical necessity, the perpetrator creates confusion in the patient's mind. The patient thinks, he wore gloves, he told me first, he was professional, maybe this is real, maybe I'm overreacting. That confusion is not a flaw in the patient's thinking. It is the intended result of the behavior. And that confusion can be paralyzing. This young woman sat with this experience and didn't know what to think. She reached out online for validation of something her gut already knew. The fact that she even had to ask shows how effectively the performance of professionalism can undermine a person's own instincts. Let's be very clear about the medical facts here. There is no recognized procedure in gynecology or sexual medicine in which a physician manually stimulates a patient's clitoris to assess arousal. There is no protocol in which a patient is asked to self-stimulate in a clinical setting as part of a diagnostic procedure. Arousal disorders are assessed through patient history, hormone panels, psychological evaluation, and sometimes referral to specialized practitioners, not through hands-on stimulation in an exam room. Some people, when they first heard this story, thought maybe this was some kind of specialized sex therapy. It was not. This was presented as a routine gynecological exam. And even in legitimate sex therapy or sexual medicine, ethical guidelines strictly prohibit any form of sexual contact between providers and patients. Always, without exception. After receiving the flood of responses, the woman updated her post. She said she would be downloading her medical records, writing out a detailed account of what happened, and filing reports. She also said she was going to look for a therapist, which is something many people encouraged her to do. Because beyond the physical violation, experiences like this cause lasting psychological harm, confusion, self-doubt, difficulty trusting medical providers, and in many cases, symptoms consistent with trauma. The response she got from the community gave her something she desperately needed: confirmation that her instincts were right. So what can you learn from this? What can you do with this information? First, know what a legitimate exam looks like. Before any procedure, you have the right to ask your doctor to explain exactly what they're going to do and why. You can look up standard protocols for whatever condition you're being seen for. If something is being done to you that you can't find any reference to in medical literature or reputable health sources, that's a red flag. Second, you can stop an exam at any time. This is not just a nice idea. It is your legal and ethical right as a patient. If at any point during a medical appointment you feel uncomfortable, you can say stop, you can get dressed, and you can leave. You do not owe a doctor the completion of a procedure that feels wrong to you. Third, you are entitled to have a chaperone present during any intimate exam. This is standard practice in many medical settings, and you can request it. If a doctor refuses to allow a chaperone or discourages you from having one during an intimate exam, that is a serious warning sign. Fourth, if something happens to you that doesn't feel right, document everything as soon as possible. Write down the date, the time, the location, exactly what was said, exactly what was done, in as much detail as you can remember. This documentation matters if you decide to file a complaint. Fifth, you can report a physician to your state or country's medical licensing board. These boards exist specifically to investigate complaints of misconduct. You can also report to the hospital or practice the doctor is affiliated with. And depending on the circumstances, you may want to speak with a lawyer or contact law enforcement. The woman in this story was encouraged to do all of these things, and she said she intended to. Sixth, please find support. Whether it's a trusted friend, a therapist, or a crisis line, you deserve to process what happened to you with someone who can help. The National Sexual Assault Hotline in the United States is available 24 hours a day at 1-800-656-4673. There are also resources specifically for survivors of medical sexual abuse. And finally, trust your gut. If something feels wrong, it probably is. The calm, clinical, professional presentation of a perpetrator does not make what they're doing acceptable. Your discomfort is data. Your instincts exist for a reason. Honor them. If something like this has happened to you, if a medical provider has ever done something during an exam that felt inappropriate, that you couldn't find any explanation for, that left you shaken and confused, please know that you are not alone, you are not overreacting, and there are people and resources that can help you. Share this video with someone who needs to hear it. It might be the thing that helps them recognize what happened to them or prevents it from happening at all. And if you want to stay informed about stories that matter, stories that could protect you and the people you care about, subscribe to this channel. We cover the things that don't always make headlines, but absolutely should.